Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, Simone Biles with her big plastic surgery reveal. She wanted us to guess what surgery she's had. Can we do it? I don't know. We'll find out. And then, a woman gets a life sentence for botched butt silicone injections that caused a death. Crazy story. And then finally, I got a video from the OR of the worst breast implant contracture I've seen in I don't know how long, and I'm going to show it to you, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. I'm your host, plastic surgeon Dr. Bruce Hermann. With me is Sarah, as always. Hello.
Howdy.
Sarah, I like your outfit.
Thank you.
I like your shirt. You look great. Did you miss the show last week? We had a week off.
Yeah.
Did you do anything cool on Friday?
No, I just rested.
Just hung out.
Yeah.
Yeah, it was nice. It was. I always hate when we miss a show, but like I was gone. I was sick, and then I was gone for a trip, and just couldn't make it happen. So, but yeah. How about you, Brennan? Did you miss us on Friday?
I did. Yes.
Yeah. You've just been busy. Lots of shows today.
Yeah, I had a lot of just one person, so it's been a long day, long morning, but doing good. I'm ready for the weekend.
What's your favorite show you do?
Definitely yours. Without a doubt. No, I'm just saying that.
What a loaded
I
question.
I tell everyone about Nip Talk.
I'd be like, geez, I don't know. They're all so bad. Oh, no, we appreciate it. But we love having you. All right. You guys ready to jump into some segments?
Yeah, I like Simone Biles.
I was just going to ask, are there any Simone Biles fans in the house?
Yeah, I'm an ex-gymnast.
Oh, that's right. You are an ex-gymnast. I should have known.
My daughter is obsessed with her.
Is he? Or she, sorry.
Yeah.
Brenna, are you a gymnast fan?
Yes, I love the Olympics. I think one of my friends met her in Target, and I can't remember. It was somewhere here, like in DFW.
Is she from around here?
I don't think so, but I'm not
sure.
They
train. I think a lot of them
train
here.
Here.
Yeah, isn't that crazy?
You know, I hate to say this, but I am just not like an Olympic fan.
I said, oh.
I just can't get into it, and I'll watch hockey because I'm just such a huge hockey fan, and sometimes I'll watch the soccer, and that's really about it.
It's only once every 4 years, though.
I know, but like, I can't do it. Like every year, I'm like, I'm gonna watch the Olympics this year, and then I'm like watching the preliminaries of skiing and shooting, and I'm just like, well, I guess that's kind of cool, but I just lose interest.
I like to watch like gymnastics, obviously.
Yeah, I mean, you have like.
And then I like to watch diving, or swimming, and then I'll watch like in the winter. I love to watch figure skating.
Do you?
Yeah.
Yeah, I don't know. I just have like a missing Olympics gene or something. I don't know. It's just it's like the Olympics is coming up. I'm like, oh great, like
cool.
Okay.
Good for you.
I was like, that sounds cool. Go America! Like I want America to win. Yeah, but okay. So this is about Simone Biles, her big plastic surgery reveal. I always love when celebrities talk about procedures they've done because I just think that transparency is a good thing. Mm-hmm. So for those who don't know, Simone Biles, 28-year-old, 11 Olympic medals, 30 World Championship medals. She is actually the most decorated gymnast in history. I didn't know that.
She's the best.
She's the GOAT of all gymnasts.
Yeah.
Good. I knew who she was. Like even though I'm not like I'm not a gymnastics aficionado.
Yeah, but she's famous for just like...
Right, she's just famous. So I do know who she is. So anyway, this last week, just a couple days ago, she posted a TikTok video saying, it was like strange facts about me, and I actually watched the whole video, and some of them were kind of funny. She's had 3 surgeries, and she thinks that no one can guess. So I did clip that for anybody who wants to see it. Roll that. It's a really short video, Brenna. So
I've had 3 plastic surgeries, and 2 of them you would never be able to guess.
So she wanted everyone to guess what surgery she had, and so before I like went too far in the article because it didn't say it till the end, I was like, okay, I'm gonna see. So I pulled up one of them I knew. And do you guys know her well enough? Do you guys have any idea what plastic surgery she's had?
Mm-hmm. I've seen this thing though too.
Oh, you have? Oh,
yeah.
oh,
I
okay.
follow her.
You do? Okay.
Yeah.
Well, one of them I absolutely knew right off the bat. Throw up the first picture, it's so obvious. Yeah, there's a big difference in those two pictures. Obviously on the right picture, she's had an augmentation. So for those people who don't, know these subtle details, like that super kind of round look that she has, where the breast is almost as round at the top as it is on the bottom, is not in any form or fashion a natural breast. And especially with her being as muscular and as fit as she is, I would expect her normal breast to look like they do in the before picture. Mm-hmm. Like she's a mega athlete. She's got a very low body fat percentage. Yeah. And just the look of that, I think she looks great. Personally, that's not my favorite result for people. But again, the customer wants what the customer wants. And so I have no problem with how it looks, but it's just obviously she's had a breast augmentation surgery, right. Which is fine. Good for her. She wants to have a breast aug. Especially being a gymnast, it's going to be hard to have.
Yeah, she's retired now.
Oh, she is retired.
Yeah, I wouldn't imagine.
I didn't know that.
I wouldn't imagine her going back to becoming a gymnast. She hasn't. She posted another video recently. She put a trampoline in her backyard, like one of the ones that was into the ground.
Oh, like a real nice one.
I want one of those.
But
she did a backflip, and she said that was her first time flipping in a year.
Really?
So she's done, I think.
Yeah. Well, I think
unless she's just taking just a really big break.
I think that the lifespan on gymnasts as a career is really short, right? You know.
Well, and then even for me, after I had mine done, whenever I do
your geometry is all out of kilter, right?
Well, whenever I do bench press, I use this muscle way more. And when people are like, "Oh, my chest is so sore," my chest doesn't get sore.
Yeah.
Because my chest muscles are not as activated as they used to be.
Yeah, they're oriented a bit different.
Yeah. So I think all of her stuff is just.
Yeah, she's just living her life now. Man, that must be super awesome to be super famous, get really rich, and then you're 28, and you're yeah, I'm just kind of retired. I'm sure she's doing all kinds.
Well, she's married to a famous NFL football person. So.
Oh, is she?
Yeah, I don't know his name. Do you know his name?
No, I think I knew that, but I don't know who it is.
Yeah, they're married and. I think she's retired, but that's just me guessing.
Yeah.
My daughter's asked me multiple times if she's retired. I'm I think so.
I would imagine. It makes sense.
She's older too.
Yeah, she's in her late 20s, which is good for Olympics. Okay, so her second surgery, I didn't pick up on. I have to say, I was just flipping through her photos on Insta for a second, and I didn't pick this one up until I read it. But once I read it and then I looked at the pictures, I was like, oh. Yeah, and this one actually really, really shocked me. So the second one that she had was a lower blepharoplasty, which is eyelids. Now, why is that shocking? Well, it's really shocking to have a 20-year-old get an eyelid surgery because normally excess eyelid skin is something that comes on with age, and she's in her 20s. But, there are definitely some genetics involved with this. If both of her parents had really loose eyelid skin, and then she would probably have really, really loose eyelid skin because she got it from both her mom and her dad. And so I went through some pictures. Throw up that next picture. There's obviously a big difference. She actually, her quote was, "I had the worst eye bags." And for a 20-year-old, that picture, the before picture, that's I don't want to say they're the worst, but they are notable that she does have a little bit of redundancy of the eyelid skin. And it was something that really bugged her, and she went and got a lower blepharoplasty, and I think she looks great. So I was just kind of shocked about that, just solely based on her age. And a lot of times celebrities, and even just normal people, will get surgeries way before they need them. But in this case, I was like, oh yeah, I could totally see how she would want that. So I think that one looks good. So the last one is technically a plastic surgery, but definitely not a cosmetic surgery. It's more of a reconstructive. She had an earlobe repair, which is something I do pretty commonly. I do, I don't know, probably half a dozen a year. So basically, she had a big looped earring, and it got grabbed, and it pulled, and it basically tore through her earlobe.
Right.
And once that happens, typically they just kind of heal, and then you have to go back and basically cut out where it's healed and re-stitch it. And so the reason plastics does it because it's really delicate.
Yeah.
And it's very three-dimensional.
It's like what I need.
Oh, do you need that? Oh, wait.
Yes. I don't know if y'all can see it, but it's...
Did we talk about that?
Is yours super... Did it break or did it
I had bigger hoops on. I was curling my hair and I just yanked it. And now it's just the skin is super low. And like the hole's a little bit too big. So.
Yeah. I can fix that for you if you ever want to have it done. Yeah.
Yes, it's very high on my
I think I'm gonna have to get Avery's fixed.
Really? The only thing about doing those earlobes is I really prefer to do them in the OR because you want to use really, really small sutures and really good fine instruments to make it just look perfect. And in the office, I can do stuff, but it's, it's like basically tying a hand behind my back and say, hey, do this really delicate job, in a less than ideal situation. But yeah, I do actually do a lot of those. They're super easy. I mean, you just, cut the tissue out, reform it. You go from the inside out. And then I usually let mine heal 3 months. And then I typically will re-pierce the ears for whoever it is. I say, come back, we got the gun. And so we pierce them. But yeah, so that one's not really cosmetic. I mean, to me, that's a reconstructive surgery.
Yeah.
But yeah, I think it was really cool of her to kind of open up about that because, I mean, obviously probably some people know, the people that follow her, I'm sure noticed, and
I noticed a long time ago.
Yeah, it's always nice when celebrities like will own up to, hey, I did have some work done, this is not just the body that I was born with, to give, people that kind of, unrealistic expectation of what normal is. So I think that's super cool. She seems like a really cool person. It was good of her to kind of talk about that. Yeah,
I think the under eye thing looks really good because she did have like really.
Yeah, she had a really kind of
she had
crazy
like really
bag.
like dark circles. Yeah. Like I mean I have dark circles too, but like I wear makeup, and she obviously wears makeup now too versus when that picture was taken. But you can tell.
Yeah, it's just pretty crazy. I'm not sure I've ever seen a 20-year-old with eyelid bags as bad as she had.
She's been under a lot of stress her entire life.
Yeah, I mean, that may play a part in it, but I mean, I guarantee if we found a picture of her parents, so her parents have to have excessive eyelids if they haven't already had it fixed.
Yeah.
Because for her to have it at that young age, it's just wild. Mm-hmm. So, all right, hey, let me recap this one real quick, Brenda. Today we were talking about Simone Biles, the most famous gymnast or most successful gymnast with multiple Olympic records, Olympic medals, world championships. She was in the news this past week because she did a plastic surgery reveal on her social media, and she said that she'd had 3 plastic surgeries, and 2 of them no one would ever guess. So I went through her Instagram trying to see if I could figure it out, and one of them is one that we all kind of knew here because we are, at least the girls are familiar with Simone, and she has had a breast augmentation. You can clearly see it in her pictures. One that really surprised me is she actually had a lower eyelid surgery. Now, why is that shocking? Because, well, she's only 28 years old, and it's very, very unusual for someone at 28 years old to have enough excess eyelid skin to need surgery. And I was kind of surprised, but when I went back and looked at her pictures, I was like, wow, she actually did have quite a bit, and I could see how that would bother her. It's probably genetic. I would assume both of her parents had it. And the last one was not really a cosmetic plastic surgery. It was more reconstructive. She had an earlobe repair. So we talked all about those surgeries. If you're interested, check out that video. We'll see you next time. All right. Cool. All right. This is a crazy story, and it's not out of Florida.
Oh, darn.
It is the United States, so obviously we know it's probably where it's going to be. California.
Oh, perfect.
It's either Florida or California. I feel like slightly redeemed that the worst plastic surgery stories are not coming out of Texas.
Yeah.
It is kind of the Wild West down here, but I don't know. People are sort of behaving. It's always Florida.
Yeah.
Sometimes California. So this story is really crazy. And actually, the worst part of this story is really on our legal system, which I'm going to rant and rave for a few seconds at the very end of this. But this is a segment about a woman who got a potential life sentence in prison for botched silicone butt injections. We may have talked about this lady before.
That woman's going to jail?
The woman on the right, yeah. So her name is Libby Adama. She's 55. She's from California. She was just recently convicted of second-degree murder, not manslaughter.
Is she a doctor?
No, she's not. Not a doctor.
But she is pretending to be a doctor?
She's pretending to be something. She was convicted of second-degree murder in October. But this past week, she actually got sentenced. And they gave her actually a range of 15 years to life, which I don't know what that means. I mean, I guess they decide along the way. I don't know. I'm really very unhappy with California's legal system, as I'm going to explain when I get a little bit further in this. But she was convicted after performing an unauthorized silicone, which means that, I mean, it didn't really say, I mean, I have to wonder if she was using like silicone you would buy from Home Depot. You know,
Yeah.
I mean, that actually...
Like what
gosh.
happened, like what Cardi B did to her butt one
Yeah,
time?
right, yes. Or was she getting something like Restylane and injecting in the butt? I doubt it, because those are 1 cc vials and you would need 500 of them to make any kind of difference.
No, whenever I heard you say silicone, I thought it was like actual like implants, like you would take like implants that you would put like in boobs, but they're made for your butt.
No.
That's not
no.
illegal, right?
It should be, but no. But I mean, you do have to be a doctor to do it.
Well, yeah.
Yeah, this lady's not a doctor. I don't think she has any medical background whatsoever.
I would like just looking at her. I would be like,
Oh, just wait. There's a better picture. Yeah.
I would
Yeah.
be like,
throw up the
you're
picture.
doing
We'll throw it up.
surgery.
Throw up the next picture. Yeah. That's her. That's her on the left. Yeah, she looks pretty reputable. The girl that died is Cindiana Santangelo. Now, I didn't know her by name, but she's an actress. And she was in like a bunch of things, nothing like huge. One of the things she was in was one of my favorite all-time sitcoms, Married with Children.
Oh, okay.
Yeah, she was nobody like big in the show, but she was like, I guess, on at a time or two. But yeah, she was like an actress. She was 58 years old, got a silicone butt injection from this Libby Adame, who definitely looks like a medical professional, not. And basically she had a silicone embolism, which is the same principle of what kills people with a Brazilian butt lift.
Yeah.
But instead of fat, this was actual silicone. I have to believe that she was using some sort of
Blockage.
industrial silicone, because I just don't know what else that she would be using. I said Restylane, and that's hyaluronic acid. I got confused there, so please forgive me for my earlier mistake. Yeah, there's no really injectable silicones that we're using in the medical field.
That's weird because silicone of it, like that stuff eventually like dries out and hardens, doesn't it?
Yeah, it looks terrible. In fact, when I was doing research for this one, there were a couple of pictures popped up, and I almost was going to put one on here, but I didn't know
That's
if YouTube
gross.
would like strike me down because it's like a bare butt. I never know like what the rules are with social, and I just like, well, I don't want to. We got a strike one time for something totally ridiculous, and I was like, well, I don't want to. It was kind of a cool picture because it was basically, here, I'll just describe it to you. You can make a picture in your mind. So it was this. I think it was a lady's butt, and it had kind of a normal butt shape, but then it looked like it had maybe like a bag of marbles, but maybe really big marbles in it on each cheek. Yeah, it was hideous. Like, it was one of the worst things I've ever seen. And I was just like, oh yeah, and that's what happens with that silicone. It gets
Yeah.
injected and it balls up.
Yuck.
So yeah, I just have to assume she was using some sort of like non-medical silicone, because you know we use silicone for breast implants, but they're already pre-filled. And I mentioned Restylane, and I just had
What if she was
some
just
sort of
like
aneurysm or something.
injecting silicone from like that?
Like
you-
Home Depot, like you inject.
What if she like got silicone from like opened up like a breast implant? And,
I don't
like,
think
was,
so,
like,
because that's a
injecting
solid.
it?
I mean, it would be hard. There's no way you could get it through like a. You can't get that through a syringe.
Oh, like it's like a.
Yeah, it's like a gel.
Yeah.
The gummy bear, right? It's like the consistency of a gummy bear. So yeah, so this poor lady, Cindiana, had a silicone embolism and died. So they convicted her of murder, second-degree murder, which I think is good as opposed to something lesser. She's also convicted of practicing medicine without a license. But here's the worst part of the story. So this really angers me. This angers me about just the United States in general, but this is a good example of it. So this lady killed someone else in the exact same way 5 years ago.
Does she have like a business?
I think no, there's no business associated with her. I think
She's
she's like
doing this
doing
at
like
her house?
It's like the Craigslist, Facebook,
It's like, hey, she's like, do you want to get your lashes done, but also,
but
do
also
you want to get injections?
do you want
in
to
your
get like
butt?
a butt lift?
My husband just went to Home Depot.
I'm sure they probably describe it a little bit better than that, but yeah, it's just like, yeah, you want to get a bigger butt? I can do. I'm a pro at these silicone injections, even though like
I've only had one death on my
I only
hands.
have one death. I wonder. You have to wonder how many patients has she done?
Yeah,
You know, like is that her only 2 patients and they
No.
both died? I mean,
probably not.
I don't know. But anyway, so she actually killed someone, Carissa Rajpal, in 2019. She was convicted of a lesser charge. I think it was manslaughter, and she got sentenced to 3 years, but she didn't even serve a year in prison. She didn't even serve a year. And then she was released, and this happened almost immediately afterwards. She went right back to doing what she did when she killed someone. And so, like, I don't know. I guess, I don't know if maybe I'm just old, but like, I mean, it just makes me super angry that this lady killed someone doing something she absolutely should not have been doing. And first off, they only gave her 3 years in prison. Like, does that seem like really light to you guys?
Yeah, it does.
I mean,
but I think if it would have happened in Texas, it would have been worse.
so you think it was California? I mean,
Yeah, I agree.
I mean, I just really am shocked at that. Like 3 years for killing someone, doing something that you know is got to be insanely dangerous, and then they only make her serve, you know, a few months, obviously, because she didn't get her first sentence until 2024, and she served less than a year, and then she's back out, and then she kills someone else. I don't know. I get really upset when I hear about that, and this happens all the time, you know, with other types of crime, right?
Yeah.
And I mean, not at all to like make this about like the crime, you know, issues, but I don't know. I saw that and I was like, really? I mean, if I was like this second lady's family, I would want to sue, you know, whoever let her out of prison or who didn't keep her in prison. This lady's a menace.
Yeah.
You know?
She needs to.
Yeah, and she's be locked away for, you know, a long time. I mean, life sounds good to me.
She needs to be like.
I mean, you killed two people.
She needs to be registered, like a registered sex offender.
She needs like a tattoo on her forehead that
says, like a registered murderer lives here.
Do not let me do a procedure on you. I have a body count, and not the kind that people normally talk about. So yeah, I mean, obviously in this story, injecting silicone into your butt is absolutely the worst idea ever. And in addition, letting someone do it that has no medical training also just catastrophically bad move. Yeah,
that's scary.
Yeah.
But also that really does make me wonder though, like whenever like because murderers get out of prison, you know, they do. And it's like, do they have to register as like a murderer like a sex offender does?
No, I don't think so.
I think they should.
Okay.
Like
hey, listen.
Like a sex offender has to like register like that.
I personally don't have a problem with that. I'm the wrong
to
person to ask because I am like very kind of low tolerance for like crime and stuff. You know, I've always had this belief that like we allow crime to happen. You know, we are as a country we're allowing crime to be bad because, you know, if you increase the sentences fivefold, the problem would solve itself. You know, so it's like, yeah, we just kind of let stuff happen. So I'm the wrong person to ask because like my views on that I think are more harsh than gentle society can tolerate these days.
Well,
but
she sounds scary.
Yeah, no kidding, right? I mean,
she
honestly, the part that angered me is she literally killed someone the exact same way, and it's just like, okay, let her out. She'll be fine. She won't do it again, and then she does it again.
I wonder if she has silicone implants in herself.
I don't think they were implants. Like she wasn't doing. It
Not
was said
implants, but like injections. I wonder if she has silicone injections in her body.
I don't know.
She looks like she would. Like,
she looks rough. She looks sketchy,
yes,
man.
does.
Like
she
that
looks
lady.
She looks like she's got some Home Depot products like in her face.
Dude, if that lady came up to me and said, "I want to do a procedure on you," I'd be like, I think,
can't help
There's no
you.
way people paid her to do that.
They did pay her. Well, I assume they paid her. I mean, why would? I would assume that. I don't think she's doing it for free.
You'd have to pay. No, you couldn't pay me enough to.
Dude, I wouldn't. Yeah, I wouldn't let her start an IVF. I mean, she's sketchy. I mean, maybe it's her mugshot or whatever. But
yeah, everybody looks sketchy when they're going to prison.
I don't know. Have you ever seen those clips of like it's like, oh, these are the best mugshots ever, and it's like, you know, these almost like glamour photo.
There is a man that has like a mugshot, and he became a model. Because he was
From his
like
mugshot?
attractive.
That is so funny.
Dude,
Yeah.
I think that honestly one of the best mugshots ever was Trump's. Remember when Trump got arrested? And he was like in that suit and he had this look of like, man, I am like super unhappy right now.
It's on t-shirts now.
Was that?
Dude,
it was that one that
I
was
couldn't
like,
even like make that. He was just like, he was kind of like smirking his lips like this. I was like, that's a hard mugshot, man. I know this guy's like an old man, but that's a pretty hard mugshot. Like he looks, and he had the suit on too. That was the best. Oh my gosh. All right, let me recap this real quick. So today we were talking about a shockingly sad story out in California where a woman basically just got sentenced to 15 years to life in prison for causing a death. She was convicted of murder, second-degree murder, for injecting silicone into another lady's backside a lady got a silicone embolism and died. So first off, injecting silicone into your butt is not a medical procedure. That's not a real thing. So don't ever do that. That's just absolutely the worst thing. These were not implants. This was silicone inject. I'm imagining like the Home Depot caulking gun would make some sort of attachment. I don't know. This lady died. So the worst part of this whole story, which really I was ranting and raving for at least 5 minutes, Sarah was giving me the eye, was that this lady actually killed someone in the exact same way just a few years prior, was sentenced to prison, but almost no time, and got out after a few months. And then she did the exact same thing again. Just absolutely just mind-blowing that happened. So yeah, I don't know why this one got me on my soapbox today.
Well, it's just really dangerous.
Yeah, it is. And it's just like, oh my gosh, like, what are they doing? Okay, I have a less aggravating story for our last segment. This one's pretty good.
Perfect.
Sometimes I get these segments from things I see in the OR. You know, a lot of the times I'm doing just the same stuff over. It's like tummy tuck, or breast talk, or whatever. But every once in a while I'll see something cool, and I'll get a video that's worth talking about. So this is a segment about the worst breast implant contracture I've seen, maybe ever. And I got this one out all in one piece, and so I took a video of it, and it's kind of cool. So we had a lady come in a while back, had implants in. They were 25 years old, saline implants, and she had pretty bad scarring. Now, we've talked, I think, in the past. I know, Sarah, you've heard me talk about it. Brittany, you may or may not have heard me talk about when implants scar up, you know, and that used to be a really big thing with the old school silicone implants of like the 70s and 80s. In fact, that's why they took them off the market, because what ended up happening is when that shell around the liquid silicone ruptured, that liquid silicone would leak and the body would react and people would get this horrific scarring, really, really bad. So, I mean, nowadays there's almost none of those old school implants left. I did take out a pair of them this year because the last year I think they put those in was 94. So that means they're at least 31 years old if someone still has them. And I did take out a pair this year, and I was actually commenting, I wonder if this is the last one I'll ever take out of the old silicone. But saline implants actually do the same thing if they're left in for long periods of time. So one thing about saline implants, a lot of people don't know, and one of the reasons practically no one uses them anymore, is they always leak. Now they leak saline, but sometimes that saline can irritate the inside of the breast. And what I've seen is when people have saline implants in over 15 years, the breast will start to scar even though it may not have been scarred early on. And the thing is when it starts to scar, it calcifies. And so that layer, which normally should be like my scrub top here, like a capsule around a normal breast implant, really should kind of look like and feel like this. It becomes like bone. Like it's crazy. Like it calcifies like bone. And so when you get people that have these really old saline implants in, like had them for long periods of time, you can get some really crazy scarring in there, and it's always interesting what you find. So I did this surgery on this lady. And
well, hold on. How did she feel this?
Oh my God, yeah. She's like, I don't know how this lady.
Because I'm like, I have saline, and mine are 15 years old.
Saline?
Yeah.
I always forget that.
Yeah, but
well,
mine don't. But mine don't feel like bones.
So saline implants at 15 years, they're starting to be on borrowed time. Like the risk of rupture starts to go up, and also your risk of contracture is going to go up. Like,
okay.
Yeah, I mean, you don't have to rush out and get them changed, and honestly, you don't necessarily have to do anything until really
you need to.
Yeah, until you need to. It's not dangerous. Mm-hmm. But yeah, I mean that's one of the reasons saline implants are, very, very few people use them anymore. I mean, there was actually a surgeon I used saline implants the other day. I was like, well, why do you do that? It's like, why? I mean, I didn't talk to him. I just heard about it. And I was like,
it's like customer choice, though, right?
Honestly, I have this discussion with myself because I have done a few saline implants in 15 years, maybe 3 or 4. At this point in my career, I'm not sure that if someone wanted saline, I would even do them.
You try to talk them out.
I would 100% try to talk them out of it. And if they absolutely were insist on having saline, I guess I'd do them. It's just kind of a hassle because we don't buy them anymore. I'd have to get stuff that I don't have. And
yeah, I think I got them because my doctor was just old. He was like an
Right.
older guy.
We've talked about that before. Your doctor was older, and he probably got burned with like the original silicone, and he wasn't buying into the new ones.
Yeah.
I get it. I mean,
Because I got mine like in 2010, 2009.
yeah, and in 2010, I would say that the ratio of saline to silicone was probably about 60-40. Now, I was a really big fan of silicone. So obviously, patients will oftentimes do what their doctors recommend, just like you did. And I was like, look, there's a lot of data on these silicone now. You know, in 2010, they'd been out almost 10 years. I was like, there's a lot of data on these things. These things are solid.
Yeah.
So I recommend you get these because the advantages of them were very, very easy to tell, right?
Yeah.
You know, they're softer.
Yeah, they feel
They don't
better.
They don't ripple. They, you know, we even kind of at that point figured they would last longer. And, you know, really the only benefit of the time of saline is they were a little bit cheaper, which that's actually gone too, because now most of the implant companies charge the same. Because I think they're trying to phase them out as well, because, you know, that's a whole nother set of implants they have to create.
Yeah.
You know, it's more machinery, more stuff, you know, more overhead. So yeah, in all the years I've been doing in private practice, I mean, I've done less than 5 saline implants, and I haven't done one in probably 8 years or so.
Yeah.
But yeah, saline. Anyway, I was like, how did I get off? I'll start telling a story, and then I'll get really into the story.
It's because I asked you, I was like, all right, my boobs don't feel like bones.
Right. Well, and you know, you may get lucky. It's when I see saline implants that are really old, and we're swapping them out, they're almost always contracted. And I bet you at 15 years, you probably have a little bit of contraction, you just don't know it. Because if it's mild, you won't feel it. It's when it gets kind of hard. But yeah, this lady, like these things were crazy hard. And so what's interesting about these is a lot of times you can't get them out in one piece. Like they'll start to break apart, or you can't get them out because you can't get behind it to free it up. And I happened to get this one out in one piece, which I would say when I remove old implants, capsules, I mean, I try to get them out in one piece, but it almost never happens. They almost always come apart or whatever. So I got this out in one piece, and it was really cool. So I thought I would take a video. You guys ready for the video?
Yeah.
All right, let's roll the video.
What medical oddity do we have here? This is a 25-year-old breast implant that is completely scarred in and calcified, and you don't always get them out like this all in one piece. And you can see this thing's pretty hard. So we're going to cut it open, see what it looks like on the inside. It's probably going to be gross. I may pop this thing here too. There we go. This is a saline implant, and this is really common with saline implants to get this calcified shell after about 15 years they start to calcify. Saline, or the new silicone don't do this. The old silicone did. But yeah, check this out. Check that out. It's so hard. Here's the implant here, of course. Now I just birthed this thing out. Saline implant. Let's see how big it was. It looks like it was a 300. And look at that. You can almost see the imprint in that. So pretty wild stuff. Pretty cool. Cool stuff in the OR. Give us a like and a follow. See ya.
Yeah, isn't that wild?
Yeah.
You said it looked like an egg. It did. Like the shell of it was like a really, really hard egg. So maybe like an ostrich egg.
Yeah.
You know, not like a chicken egg. It was harder than a chicken
Yeah.
egg. You know, it felt like almost like a baseball. You know, I don't know if you heard, but when I dropped it on the table, it's like thunk.
Yeah, I did.
You know, I mean, a breast implant obviously should not be like that. It
Gosh,
should
I
be.
hope mine aren't like that. Well, they're not.
It should be
but still.
soft. Yeah. I mean, you're probably fine. I mean, I will tell you that, you know, at some point in your life, you're gonna have to swap those things out.
Oh yeah, for
Yeah.
sure.
And
I know whenever I go do my lady doctor, when the lady doctor like feels you up to make sure you don't have
Yeah, right.
any breast cancer,
Yeah.
they always tell me, oh, they always know that they're fake, but they're like, okay, everything feels good and your implants feel
I mean,
like
if they're not
supposed
bugging
to
you,
feel.
you're fine. I mean, I wouldn't stress about it.
So, well, it makes me feel good that they actually check for that at my doctor's office anyways. Whenever I go to the lady doctor. They tell me that they still feel good.
You're like, yeah, everything feels normal.
Yeah.
Yeah, it was pretty wild. You don't always see them like that hard. I mean, I probably should have like picked that
Did
thing
you
up.
show her?
Did
you show her that video?
No, not yet. I will. Yeah.
I would. She'd probably be like, ew.
Yeah.
That was inside of me, thanks.
Yeah. It's just crazy. Like that, the shell of like those things it's almost like an eggshell.
Yeah.
It was satisfying to me.
It is. There's some satisfying
Dr.
to like
Pimple
open
Popper.
it, like opening that thing up, right? And
Yes.
it's like you it's almost like that thing gets burnt out of there. It just like jumps out like a.
It looked brand new whenever you
Like a
pulled it out.
dinosaur
Though.
comes
Yeah.
out of it.
Yeah, right. And you know what's crazy is the implant looked pretty good for being 25
Yeah, that's what I was saying. It looked
years
brand
old.
new.
It did. It looked really good. I was just like, wow, that actually. I thought it would, look like, a hot mess because
Yeah,
of how
'cause-
calcified it was, but I don't know. Sometimes, like in the old days, people would mix stuff in with the saline, and I almost wonder if that, plays a part in it. Sometimes.
What is it? Maybe just like her? Like, what if that's just like what
No,
her body
because-
is more.
Because
apt
if that
to
was
do.
the case, then you would see that with the new silicone implants, because now you have new silicone implants that have been out 25 years, right? 2001, so basically 24. We're not seeing that at all. I've opened up people that have 20-year-old new generation silicone, and the capsules look completely normal. Every time you open up someone that has old saline, like that old, they're almost always like that.
Yeah.
Not every time, but man, like more times than not, especially once they hit about 20. So I don't think it's her. Like to me, the correlation is the saline implants.
Yeah.
Like they're just really not designed to stay in that long.
I'll probably have to get migraine done after I have one last child.
Yeah.
I think.
Oh yeah, that's a big step. Yeah. Is that?
No, I'm not pregnant.
Oh, okay. Is there an announcement happening right now?
No, but like that's something that me and Cody want.
Yeah.
So.
Cool.
She's like, surprise.
Surprise. Yeah, I mean, and definitely, it's really common when people have implants and they get done having kids. They'll like kind of get everything back into
Yes.
where they want it to be. That's
Hopefully
super
I'll
common.
just. Hopefully
a
I'll
guy.
just have to be. Yeah. Hopefully I'll just have to do that and not anything else.
Yeah. Right. Yeah. Definitely. Yeah. If you can get away with
I was really good about when I was pregnant, like putting almond oil all over my tummy. Like anytime my stomach
So-
got itchy.
I feel that the biggest factor because we're talking about needing a tummy tuck, right?
Yeah.
So the
Or
biggest
just like extra skin and
Yeah.
like scarring stretches.
The biggest
marks and
factor,
stuff like
I think
that.
there's two factors. One, just how much weight you gain.
Yeah, for sure.
The less weight you gain, the less likely your skin's going to get permanently stretched out, or your abdominal wall, which is the other one. How many pregnancies you've had. When you get into like 3, 4, or more pregnancies, it's almost impossible to not have some permanent changes you don't want. But then also like how quickly the weight's gained. For some reason, some people like gain the weight like super early, and it's just like they just get stretched out really, really fast. I think
Yeah.
that does more damage. My wife had two. We have 2 kids, and she doesn't need it at all. Like, but she didn't gain a lot of weight either.
She's tiny though.
Yeah. She only gained I think 20 pounds with the first, and maybe 30 with the second. And
Yeah, I think I gained like 30 pounds with Avery.
Yeah, the second one gets you. You
I
have
was
to-
like full of water too. She made me retain so much water.
Really?
Like after I had her, there's like a picture of me like right whenever they put her like on me, and then like within like 8 hours, my face looked completely different. Cause like towards the end of my pregnancy, it looked like my nose was like huge. My lips looked like I had filler in them. I was
my
just
God.
like
Your
retained
pregnancy makes you just
so
like
much water.
It just kind of breaks you down. I always say this all the time. I really feel bad for women with the whole pregnancy thing.
It
'cause
is. It's
like,
a tough life.
Like it
All
just
right,
totally
thank
kind of
you.
messes with your body, and
We have a lot of responsibility with our bodies.
Yeah, I know. I am super like not jealous that I don't have to go through that. That just
Yeah, you
sounds.
shouldn't be jealous.
I'm not at all. I'm just like, well, dang, I'm really glad things worked out, or I'm not the one that like has to like carry the pregnancy.
I
Yeah.
watch lots of like TikTok pregnant women like vlogs or just stories and fun facts I learned. I'm like, it's just so crazy to me. And like you said almond, what was it? Almond oil?
Mm-hmm.
I've never heard of that.
Yeah, I went to this, it's like a French cosmetic, like, they sell like all kinds of stuff, like lotions and all that kind of stuff. I think it's like L'Occitane. I don't know how to spell it.
Oh yeah, I know what you're talking about.
Yeah, they like have this great almond oil. I even like recommended it to Avery's stepmom. I
mean-
was like, I don't want you to get stretch marks either.
I think that probably I mean, I don't know about almond oil. I mean, that's probably another one of those things where it's like got some lab research on it. I mean, to me, the best thing to do is just get a really good moisturizer. Don't let you get your skin dried out. Keep
Yeah.
your skin as healthy as possible
Yeah.
when you're pregnant. But I mean, honestly, far and away, I think the most important thing is just like how much weight you gain. And you gain 80 pounds, like your skin's wrecked.
Yeah.
You know, I mean, it's just going to be wrecked. You know, genetics also plays a part. You know, some people are predisposed to have more elastin in their skin. So elastin's the part of the skin which gives elasticity.
Yeah.
And so, yeah, a lot of it's genetic. Also, too, if you've had a lot of sun exposure in your life, like if you're a beach bum, you know, out there in the, you know, putting Crisco on yourselves in the summer, like your skin's gonna be not do well when it gets stretched
Yeah.
out. So like it's super multifactorial.
Yeah.
As far as, you know, okay, you have a pregnancy, like how's it all gonna like shake out at the end?
Do lasers get rid of stretch marks on your tummy?
It can help. Yeah, I mean, lasers are pretty good at tightening skin. For like body stuff, we use more microneedling. You can use laser on the skin, but microneedling works really good. And the microneedling is there's actually a handpiece designed for body. So that's what if you weren't gonna do something surgical, that's what I would use.
Yeah.
I'm about to get I need another laser treatment. I was just telling the girls at the office, like, man, I'm due. I need to get in there and get that laser. It's time, man. I'm getting old. I'm having, you know, old people problems.
Can we do it together?
Huh?
Can we go together?
You want to do the laser?
Yeah, I want to try it.
You can come in and do it. Yeah.
I do too. Count me in.
You're a little early for the laser, Brenna.
She's just like laser.
I've
mean-
like seen so much on it though. Like
I mean, if you
Or-
want to try it, we can like bring
I've
it
seen
in.
like laser hair removal. That's like my biggest interest. I'm like, wow.
Yeah, do you have that at your spa?
We do. So we use a
Sign me up.
we use like a we use a IPL hair removal. Yeah, I think it worked. The only thing about those treatments is you got to do a bunch of the treatments.
For sure.
Like one treatment generally doesn't do it.
Yeah.
I did a laser on my chest. We had a girl that worked for us for a while, and she had her own laser hair removal thing. And I was like, yeah, because I know it's weird, but I don't like chest hair.
Yeah.
Like that's just not my bag, man. I'm not the Magnum PI guy with like, you know, the hair coming up or whatever. So, but like I do, you know, generate a lot of hair. And I
Yeah.
was like, zap it off. So I did some laser treatments and it really worked great. In fact, I mean, now it's started to grow back, but it takes it forever to grow. And then
Yeah.
I just like,
I have one of those like handheld ones.
really? Does that
Ones
work very
that-
good?
I'm just like really bad at doing things consistently.
Right. And yeah, the home ones you have to do like a lot.
Yeah, you have to do it pretty much every day.
Yeah, it's kind of crazy.
Yeah.
But.
And you have to wear sunglasses when you do it.
Yeah, we actually talked about getting a better hair removal system. It's just we don't get people asking for it, you know. And it's like, well, we have so many things that we want to buy for the med spa because there are some really good machines out there. And it's like, okay, yeah, that's going to be down on the list, you know. And those machines are not cheap,
Yeah.
right? So I don't
No.
like to like, you know, you always buy them and pay them, or we do. I'm sure some places just pay cash, but we pay them off as we go. And it's like, yeah, I don't want to like be on the hook for like 3 or 4 machines at a time. So like, you know, we get a couple things and then we pay one off, we get another one, and
Yeah.
so I don't know if we're gonna, but we do have it. If you guys are like desperate for hair removal, like if you guys want to come down to the place, I mean, yeah, I mean you can do it. I'll have to ask. You know, my wife did it. I meant to ask her how she liked it.
Yeah.
I forgot.
Yeah.
I'll ask her and then I'll report back to you. But the one we have is pretty well known. It's called Forever Bare. It's basically a
Cute.
Sciton IPL. Yeah, it's a cute name in it. Yeah, and it's just basically intense light that just basically fries the hair follicle.
Yeah. Yeah.
It's I mean, laser IPL and lasers are similar, right? I mean, the lasers are obviously stronger, but you know they're similar action. So. So, all right, I'll just recap this real quick. So today we had one of the wildest videos I've got from the OR in a long time. This is a lady who had very, very old saline implants. They were about 25 years old, and she got the worst severe scarring I ever seen. And what was interesting, I got the scar and the implant out all in one piece, and this thing was like a baseball hard. It was so hard, and you could knock on it, and it felt like you were knocking on bone. And I had a video where I opened it up. It's a pretty crazy video. Highly suggest go to the YouTube video and check it out because it's pretty wild stuff. So, all right, we cool?
Yeah.
All right, I think that's a show. I think we did it. Good job, you guys. I felt, pretty good after being off a week that we were going to get right back
Yeah,
into
glad
it.
you're
We
back.
did. Yeah, thanks. I'm
Safe
glad
and
I'm back. Good to
sound.
see you guys. All right. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Leave some comments. If you have something you want us to talk about on Nip Talk, we will do it. Leave us a comment, and we'll talk about it next time. See ya.
Bye.
Bye.